Welcome to PCR TV. It's my very great pleasure to welcome you here today. We have with us the highlights of the best abstract and also the best clinical case. Welcome, gentlemen. If I turn to you first of all, Ziad Ali, please tell me a little bit about the process that you've been through in order to win this wonderful prize.
So it's actually a very unique structure involving 3 rounds. The first round of which is actually like a sales pitch. You have 3 minutes to talk about your project and no slides at all. The second round, you have some slides, and on each step you're actually coached by a specialist who helps you to make sure that you're getting the optimal information across. And then by the time you get to the third round, it's more of a conventional approach presenting your scientific data.
That's incredible, and in total there were 920 abstracts presented and many more submitted, so that's fantastic. Could you tell me a little bit more now about your own study?
So our study investigated patients who have advanced chronic kidney disease who are frequently undertreated by revascularization because of their risk of going on to dialysis or contrast-induced nephropathy. So we actually described for the first time ever in advanced chronic kidney disease a method to do PCI with 0 contrast. And by doing so, feel we can impact these patients and have them appropriately treated.
That's a really exciting and novel concept. Can you tell me what impact it might have on our patients in our own cath labs?
I think it takes away the avoidance and the risk where people who need treated, perhaps one of the most highest risk groups, are actually revascularized for their need from a cardiovascular morbidity rather than their risk of developing dialysis or need for further renal replacement therapy.
That's a really exciting concept and a real practical solution to these difficult patients we have in the cath lab. Ziad, thank you very much indeed. I'd like to now welcome Mateusz ORZALKIEWICZ from Birmingham in the United Kingdom. Matt was the winner of the Best Clinical Case prize, and in total were 989 submissions, so congratulations, Matt, for winning that.
Thank you very much.
Your case was very interesting. Please tell us a bit about it today.
What we showed today is a treatment of a very rare congenital heart almighty, coronary artery fistula, and we wanted to stress the importance of cooperation and involvement of multidisciplines into the treatment, actually implementing novel techniques to finally succeed with a successful closure of the...
That's fantastic. I hope I never see another case like that again. Maybe you could tell me what you've learned from it.
The whole experience, it's a stage learning. First of all, you need to find a case and find the case you can send a message across to others, learning point to others. Then preparing the presentation, the slides have to be interesting because you're only allowed to so many slides and they have to be in a special format. And then presentation skills take also a great part in preparation.
So a formative experience as well. Thank you very much indeed. We had a joint winner today because the field was so very strong in the clinical abstracts. Dejan, thank you very much for coming along today, and many congratulations for being a joint winner in the clinical abstract cases. Please tell me something about your trial today.
Thank you, Patrick. Well, what we did was to test the possibility of immediate invasive intervention versus delayed invasive intervention in a subpopulation of non-ST segment elevation acute coronary syndrome patients. And this subpopulation was non-STEMI, so troponin elevation on admission coupled with ischemic ECG changes. And we showed that in this population there is a sustained benefit up to 3 years conferred by the immediate invasive intervention.
Dejan, maybe you can tell us what you mean by immediate. There are a lot of nervous cardiologists around who are already struggling on primary PCI rotors, hard enough to manage the STEMIs. What was immediate for non-STEMI in your trial?
In our trial it was 1.4 hours after admission, so it's really immediate. So
wow.
It will probably mean more work for us, but this is a single center randomized trial. It needs to be corroborated by larger multi-center trials in order to get into the routine clinical practice. So we are looking forward to it.
Again, a very strong clinical message, Dan. Thank you very much indeed. So you've heard from the joint prize winners, from the clinical abstracts, and also from the clinical case. It's my great pleasure to join them in celebrating their success. Thank you very much.
Thank you.
Thank you.